All right, hello and welcome to part two. Again, my name is Matt Cotty. I'm a licensed clinical social worker and I'm the founder of the OCD Academy. And in this video, we're going to talk about mental compulsions when it comes to pure OCD. And so, like I said in part one, if you haven't seen part one, be sure to check that out before this video because it's a three-part series. But in part one, I talked about this idea of pure OCD and how, the four parts of the OCD cycle with the obsession, the compulsion, and the obsession, the uncertainty, the doubt, and then the compulsion, and then the relief. And in a typical OCD experience, people can usually spot the compulsive behaviors that person's doing. They might be checking or washing, right? They usually have these physical compulsions that they're doing. One of the things that makes pure OCD a little tricky, especially for someone doesn't have a lot of experience with it, is that a lot of the compulsive behaviors that people do are mental. Okay, so they'll have the obsessive thought, whether it's harmful, sexual, or religious. They'll get anxious, they'll have the doubt and uncertainty, and they'll engage in different mental compulsions that reinforce that cycle. Okay, so one of the things that we need to do when it comes to treating pure OCD is identify the mental compulsions that people are doing. And in most instances, they're going to be probably 80% of the compulsions that people are doing when it comes to pure OCD. So I don't have time to list every compulsion out there, but these are some of the things you're going to want to look for. Something like thought suppression, right? Like trying to push the thoughts away. That's actually a compulsive behavior because when you think about it, if the person has the thought, right, that just kind of pops up in their head and they get anxious and they react to the thought by trying to push it away, that's actually the compulsive behavior that draws the relief. Okay, so it can be a quick little reaction that they have, but that is the compulsion that we're going to want to look to eliminate. Or things like thought replacement, counting in your head, even something like praying. And that's why when we have the religious obsessions and then the person prays to try to address those thoughts, that actually reinforces that fear in that cycle. And so in those instances, prayer can be a compulsion. And then there's also all the different things they do to avoid, right? So anything you avoid that actually can trigger those thoughts is also a compulsion. And then finally, any type of reassurance or mental reassurance is another huge compulsion that you're going to want to look for. And so what I've done is I've actually put together a compulsion inventory on my site where you can go through and it's free to download. So all you need to do is click the link below and you'll be able to get access to it. And you can actually start looking at some of the different compulsions and start to identify different compulsions that you do when it comes to pure OCD. So be sure to click on that link below this video and you'll be taken to a spot where you can download it for free. And again, and in part three of this video, what I'm going to do is I'm actually going to talk about ERP and how to apply it when it comes to pure OCD. So I will see you over in part three of this video. Again, be sure to click the link below to download your inventory, and I will see you over on part three.